Fern Cuneo, Communications 101, Liberty University, Fall 2012. First of all, I'd like to thank my family, friends, and coworkers for coming tonight and assisting me with my assignment. The assignment is a persuasive speech. The title of my speech is a little bit different. It is The Refrigerator Nurse versus Compassion. There is such a thing as a refrigerator nurse. It is important. When we think about a refrigerator, as I'm using that as an analogy, it is an important appliance in the home. We do keep things in our refrigerator. We keep our foods, our fluids, and we keep those things that need to be kept from spoiling in the refrigerator at all times. So it is important to have this appliance in our home. It is also important for the nurse, as I refer to her as a refrigerator nurse, to be just that. A refrigerator nurse is one that learns the skills. Skills are very important to nursing. Knowing how to use a stethoscope, learning how to listen to heart tones, learning how to listen to bowel sounds before and after surgery, learning the ins and outs of how to deliver a baby, learning cardiac, learning vascular. These are all important issues of being a nurse. Applying yourself to study. I was looking at some of my books today, and they are over 34 years old. And I have kept them, I have used them as a guide throughout the years of nursing. Very expensive. If I had to buy them today, I don't know if I could afford to buy the books that are required for nursing today. Very heavy. I would also have to hire somebody to carry my books around because they are so large. Very important that we apply ourselves to studying and knowing and having the knowledge. Solomon in the Bible speaks often about wisdom. And it is wise for a nurse or anyone that is preparing for their career to study and apply themselves to what is important to that career. Obtaining your license as a registered nurse requires long and hard hours of study. Proof of your accomplishments has to be gained by state and national licensing. Maintaining your career as a nurse requires long, grueling, and shift change hours. The refrigerator nurse has skills, knowledge, yet can be without compassion. And when I speak of compassion, what do I mean? We can go through our daily work, we can be with our patient, and yet we can lack compassion. What is the factor that makes the difference with compassion in our lives? With much thought and much prayer, I have considered this, and compassion only comes from the Lord. When we look at the things that we have to deal with as a nurse, there are many things that are discouraging. The cohesiveness on the job is very poor. Lack of recognition of our applied skills. Intense scrutiny is always there. The overload of patient-nurse ratio is astronomical and intense. Misunderstanding of job requirements. Nursing is not for the weak, lazy, and faint-hearted. I contend tonight that the missing component of the refrigerator nurse is compassion. And compassion will only come as we ask the Lord to endow us with that. He is our great example. Compassion is a virtue received, not forced. Compassion is a virtue, gift, desired. Compassion comes from the Lord, who is our great example. We think of Jesus when he looked on the multitudes. He had compassion. When we are at work, sometimes we are overwhelmed with the number of patients, families, doctors, co-workers that want this, they want that, and they want it right now. The multitude that we deal with on a daily basis. Yet Jesus dealt with the multitude and he had compassion. He looked upon the children with compassion. Children were important. We can liken children unto the needs of our patients. There can be extreme amount of work to be done. We can have a patient that has 18 medications to be given at 9 o'clock. All of these things have to be done in a timely order. Call lights going off. Yet there is that one little patient that so desperately would like a touch, would like a warm blanket, and it takes compassion for that patient to meet that need in such a busy, hectic world. We think of the woman with the issue of blood, and it was in a crowd, it was on a busy day, that she pressed through and she touched Jesus, and he had compassion. On our busy days at work, when we see the crowd and we're overwhelmed with the amount of work, there is going to be that one little patient that needs to touch us and needs to know that we care and needs to know that we have compassion in our hearts. We think of Jesus when he was crucified and as he was on the cross and that grueling moment in time where everyone misunderstood. Yet he took time and he looked at his mother and he had compassion. And we need compassion that can only come from the Lord during those grueling times for those people that are so desperate for the touch of love, for the touch of understanding, for the touch of compassion. I appeal to you tonight that we as nurses, we in the medical field, need to call out to the Lord for him to do a work in our lives that we may have compassion, that we do not remain a refrigerator nurse, but that we continue and we call upon him daily for his strength, for we need compassion. He does not leave us comfortless. He has promised us the work of the Holy Spirit in our hearts and in our lives. And we can trust him. It is the Holy Spirit that brings compassion into our hearts for our patients, for our jobs, and for our lives. Thank you.